Hi, welcome back to the podcast. I'm Dr. Lindsay Renzullo,
I'm Dr. Krista Vernaleken.
and we have a really fun episode today. We actually have a doctor from Wheat Ridge Veterinary Hospital in Colorado joining us, Dr. Justin Pochman, right? Did I pronounce it right
Nope,
or did I said it
Pochman.
wrong?
Pochman.
That's okay. It's Pochman.
Pochman. All right. So he's from Colorado, and we thought that he could, be a part of our discussion today when we're talking about heartworm disease in our pets. And so, Justin, do you want to give us a little bit of information about you, bio, kind of, a little bit about your practice and things like that?
Sure, happy to do so. So my name is Dr. Justin Pochman, and I'm a practitioner, primary care practitioner at our Wheat Ridge Animal Hospital location. So we are one of the larger hospitals serving the greater Denver metro area in Colorado. And I've been with the practice for 6 years. I see all range of primary cases from vaccinations to relevantly heartworm disease and things of that nature. And so thank you so much for asking me to join today. Hopefully that's enough information, but if you want any more feedback, I'm happy to provide it.
No, I think it's fun because Wheat Ridge and Balger, where Krista and I are at, are very similar in the sense that we have this wonderful general practice part of
Mm-hmm.
the hospital.
Mm-hmm.
And being primary care, clinicians, all of us, it's sort of a nice common denominator that we all have together. So,
Sure.
yeah, we wanted to discuss heartworm disease just because this is something that we do see. It is present in all 50 states. So it's not something that's only localized to one particular state or one particular area in the country, which is why I think it's important to have you here. And I thought we could just kind of talk to our viewers a little bit about what heartworm is, because often people think heartworm disease, they think of worms, they think of gastrointestinal type of parasites. So,
And it's Heartworm Awareness Month, which is the other big reason why
that
we
is
were
true.
talking about it today, right?
Yes, that is true.
Very exciting.
And that.
Yeah, and that. So, I don't know, Justin, do you want to
Sure. Yeah. Yeah.
give a little intro about heartworm?
Yeah, so I think this is a common conversation that we probably have with a lot of our clients, all three of us. But it is a common misconception that people think of heartworm as maybe being a gastrointestinal parasite or something like that, but it's actually a blood parasite that is something that is vectored or carried and transmitted by mosquitoes. And so it's one of these diseases that dogs, as you said, across all 50 states in the U.S. can get. They become infected with the disease, contract the disease by being bitten by an infected mosquito. And so it's one of these diseases that almost any dog can be prone to getting. And so we really need to be cognizant of what it is, how common it is, how we can try and limit the transmission of it in our pets. Because it does have some serious health implications for our pets. And so yeah, and it's, as far as, it's actually called heartworm disease because it commonly, the mature infection, those mature worms as they grow and develop in the body will reside near the heart, but commonly in the blood vessels of the lungs just adjacent to the heart. They can also back up into the heart, which is why it's received the common name of heartworm disease. So yeah, that's kind of a brief overview of what the disease is for
Yeah. And
clients.
I'll give a little shout out to my friends Charles and Joanne, who commented to me that we don't talk a lot about cats. And so I'm going to keep
Sure.
interjecting stuff about cats here too. So cats can
Yeah.
get heartworms as well. They don't get it as commonly as dogs do, for a lot of reasons. They tend to not be, they're not the ideal host for the heartworm, so the heartworms don't prefer to live in the cats. So their bodies are a little bit more effective at fighting them off, but they still can get them. And cats, a lot of our cats reside indoors and maybe are just less exposed to mosquitoes overall, but cats can also get it. So we'll keep those guys in mind throughout the podcast too, because
Yeah, we need
they
to
they
know. And I mean,
they
and
watched my
sometimes in
podcast and they
cats,
were like, you have to talk more about cats."
well, that's true. And sometimes with cats, because they don't get the same form of disease that dogs get, and something that we're much more aware of, that these cats can be really sick and they can go undiagnosed. So often,
Sure.
because they only have one or two worms that are living inside them, they can still pose a big health problem for these kitties. And we're not necessarily having heartworm disease sort of as the top of mind. There are other diseases that are much more common that can cause a lot of the clinical signs that heartworm disease in cats
Hmm.
will cause.
Hmm.
Um,
Yeah.
no, but
So
I think
how
it's
often
important.
do you see heartworms out there in Colorado?
Um, in dogs, just in general, We just talked about the fact that it's transmitted by mosquitoes. And so Colorado is, or at least where we live, Denver, Colorado is a high alpine desert is what it's technically
Yep.
considered. And so we have a fairly dry climate. There's not a lot of standing water and things of that nature. And so mosquitoes, great reason for people to move to Colorado. There's not a lot of mosquitoes here. And so that means that we don't have the same prevalence of heartworm disease in Colorado as some other states. Certainly, the South and the southeastern U.S. is probably the most common area where you think of it being hot and muggy and that kind of thing, where there's lots of mosquitoes. But in Colorado, or we have a limited number of cases, but it seems to be growing every year as as I look at county data or aggregated statewide data. There's a higher caseload every year that it's reported, and it's one where you talk to some older pet owners and clients, and they say, what's this heartworm issue that my vet
Right.
keeps talking to me about it. We don't have that in Colorado, and that's a fallacy. Historically that was true, maybe 15 to 20 years ago, but now we do have heartworm, and it's endemic here, meaning our canid populations that have never left the state of Colorado will get infected with heartworm disease, and that means that we have it here, and we have a growing caseload every year. So not a hugely high risk, but it is one that we want pet owners to be aware of, and we want to provide sound information so that they understand what the risks of the disease are, because it's very serious, and when dogs and cats have it, there's a lot of health implications, a lot of cost implications. So.
Yeah, and I would imagine in Colorado it's very similar as in Massachusetts. So even though we do get mosquitoes and we are known as, an area of the country that sort of has a little bit more heartworm than maybe Colorado, we do get a lot of shelter dogs from down south, as you probably
Mhm.
do, I would assume. Does that seem to be similar in Colorado too, where you're getting a lot of dogs from the southern states where heartworm is much more common, and those are sort of acting as a vector of bringing the disease up?
Yeah, absolutely. And that is very true, the statement you just made, because we do in Colorado have a very high percentage of the population that owns pets, that are seeking pets. And so, as such, we are one of the larger states in the country that brings in shelter and
Yeah.
rescue animals from out of state. I was just looking at a study recently. It's a little dated, it's from 2017, but I think the biggest states that we bring dogs in from in Colorado are New Mexico, Texas, and Oklahoma, but there's still a lot of other southern states and other states where heartworm is a lot more prevalent. A lot of those are street dogs that don't maybe have a history, certainly are not on a heartworm preventative. And so a reasonable percentage of our cases are those coming in from out of state that are
Yeah.
bringing it with them. So, and I'll piggyback on that to say that it's theorized that why do we have heartworm in Colorado? It's probably not from migratory mosquitoes moving in. It's probably from those dogs from out of state bringing it with them, and then our local population of mosquitoes and canids transmit it, infect the population, and then that
Right.
kind of starts the life cycle going locally. So,
Yeah.
Yeah, I've treated more heartworm dogs this year than I probably most of my career, but
really.
I've had myself 3 or 4 cases that I've treated, and
Hmm.
all of those, most of those dogs did contract it locally. So there was one that I think came from a rescue, and the others all just were not in their heartworm prevention,
Hmm.
um,
Hmm.
and they contracted it.
Yeah, so that
We
brings up
definitely
like
have
the prevent.
mosquitoes.
Yeah, that brings up the prevention, right? So, I mean, I'm kind of curious to see in Colorado what you are recommending as a primary care veterinarian. There are a ton of options out there. If you're watching like Animal Planet, all of the ads of, Sentinel and HeartGuard and all these different types of preventions that, will be advertised to clients, but there are a lot of different options and things that are
Hmm.
available. So, do
Hmm.
you have any particular like lovely combinations or meds that you like to use or like to encourage your clients to use?
Yeah, so I think there's a number of reasons that we recommend one therapy over another, preventative over another. And so I think specifically at our hospital, we will commonly recommend something that's a combination of a good preventative that will prevent heartworm disease in the form of milbemycin. And these are drug names.
Right.
We'll get into trade names, but like milbemycin or moxidectin or something like that. But they also contain a good broad spectrum GI dewormer, so we can cover the gambit of most, if not all, of your internal parasites by both blood and GI. And so commonly at our hospital, we prescribe Interceptor Plus, which has that combination of milbemycin and praziquantel. For our clients out there listening, that will treat and prevent your larval infection of heartworm, but it will also treat your major forms of gastrointestinal worms, from roundworms to tapeworms to whipworms, et cetera. So we go with that product because it's reasonably priced. It covers a very broad spectrum of GI worms as well as the heartworm. But then also, there's some other products out there that have additional things. So Sentinel Spectrum is a great product, but it also has luflenuron, which is a medication that prevents, correct me if I'm wrong, but flea eggs. Is that
yeah.
what it is?
Mm-hmm.
Yeah. And so that's because we don't, in this arid climate, have as much in the way of flea and tick.
That makes sense.
We do that separately. So we will add in a separate medication for that, as opposed to having something that prevents also fleas. So that's a little bit more expensive because it has that medication in it. There's also injectable products. I don't know if you guys use some of the ProHeart products that treat for either 6 or 12 months, but that's not something we use at our hospital, more for logistical reasons. And also our medical directors have some concerns about some historical data about reactivity to those injections, since you can't take it off once it's been given. So, that'd be an interesting discussion to hear what you guys use on the East Coast and such.
Yeah, we often use combo products as well. So, I can't really think of too many of the heartworm preventative products that don't have the GI parasite. There's a few little, like for dogs with allergies, that might have just the heartworm. But where in our area, ticks are massive problem, and
Sure,
so
sure.
we often will use, we've used Simparica Trio, which is a combination product that does effectively everything very well. And so, but honestly, it's any prevention is good. If you can't, let's say, afford one of the products, that your vet is recommending necessarily as the first line, there's often a generic option or something that's less expensive. So, and yeah, we do use ProHeart. ProHeart, it's really for very specific patients that have compliance problems. So I give my dog ProHeart 12 because I am a
Compliance
vet.
problem.
You're
I
admitting
have the
openly
worst
that
compliance
compliance is an issue.
problem ever. I never remember to give the stupid heartworm.
Right.
So I do that. And then I give it at the time of the annual vaccines, and I don't have to worry about heartworm, but it doesn't do anything for GI parasites. So, you have to pick your product based upon what your specific dog is exposed to. And that's where your vet comes in. We want basically you to talk to your vet about what works for you in your region, especially as you've seen. Justin has a different, you know, coming at it from a little different parasite control perspective than we are, just because
Right.
of the different region of our hospitals.
Yeah, that's interesting. And the flea not being really an issue there, I think is crazy. Is
They don't
awesome.
have
The
any
fleas are
bugs
thick.
there.
I know
You
it's
have,
crazy.
but yeah,
Interestingly enough, we don't have hardly any fungal disease either, and other
Right.
infectious diseases. So
No blood.
it's a whole different ball game out here, but that's a separate discussion. So
yeah.
Yeah, I've heard it's lovely. I've heard it's lovely.
yeah, we'll have to have you out sometime soon.
Yeah. So I think that a lot of owners though, and because of the varied climates, often think that, oh, if they're in the middle of the winter somewhere, you don't need to necessarily treat, right? Like mosquitoes are dead in the middle of the winter. So, I think a
Sure.
common thought for a lot of people is that they don't really want to treat year round. They only want to treat sort of seasonally. Um, my typical take and the way that I sort of guide my clients is I tell them I really want them on this year round for a couple of different reasons. One is it really gets them really into a very good habit of sort of giving of medication
Back to the
consistently
compliance
every
problems.
compliance problems is a big one. The second thing is we do have GI, GI parasites. So a lot of these dogs that are going and, going out to dog parks or daycare or just even out for a nice walk in the woods, the GI protection of those gastrointestinal worms, so different than heartworm, is in a lot of those products. And I think it's beneficial to have those patients on it year
Mm.
round because of that as well. Do you have the same sort of pushback from a lot of people out in California or
She's in
questions
Colorado.
about whether or not
He's
they
in
need to do it?
Colorado.
Colorado, not California. So sorry. I know. I
I know
it
what
was
you
a
meant. I
total
know what you
slip up. Uh,
meant.
total slip up. But do you get the same pushback from Colorado?
Yeah, we do. And so it's kind of what percentage of your clientele is giving you that pushback, and it's the minority. I anecdotally I feel like our compliance is really high with year-round heartworm and GI worm prevention. The overwhelming majority of our clients do comply with that. Now, actually giving it, to your point, Krista, is sometimes a little bit of a challenge for clients. So I talk through options of trying to get people more compliant on a monthly basis via injections or via, monthly mail shipping. That's always a really good
Yep.
option.
Yeah.
For some clients, if it shows up the first of the month, every month you open the package, you give it to your pet. It's a great way to eliminate that whole I forgot problem. But yes, certainly people give me some pushback, and we have I use very similar talking points, to educate people about why we recommend it year round that you just outlined. I think one thing that's interesting about Colorado, if you haven't visited, is that we have these massive temperature swings. So it'll be January and it is single digits or, in the teens, and then it'll all of a sudden warm up to 70 the
Yeah.
following day and be in the 70 degrees for several days. And so it's always really tough to predict when mosquitoes are going to be out. Do they come out of dormancy in the winter, in the early spring, in the late spring? And so if people are only regimented to, treat their pet for a 4 or a 6 month window, it's really tricky to guarantee that they actually have appropriate coverage because you never know when
Right.
mosquitoes are out. So that's kind of a unique um, situation we have here in Colorado, just given our climate.
Yeah.
You
Yeah.
know.
I mean, we do get those weeks too here. And no one ever thinks about it in terms of the mosquitoes. They think about it in terms of ticks. We see in January it gets up to, it really doesn't get up to 75 in January very often here, but
Lucky it did.
it'll get up to 55, and that's
Mhm,
warm enough
mhm,
to foster that mosquito life cycle.
mhm.
And everyone's pulling ticks off their dogs, but they forget about the heartworm part. And I cannot
Sure.
think of how many people I see in July or August for their wellness visit, and they go, "Oh, I haven't started my heartworm yet this year." Like,
Yeah,
"Oh,
So true.
it's too
yeah.
late now."
Yeah, and that is a really tricky point with, I understand and I have conversations with clients that just want to do seasonal prevention, but then you need to coincide your wellness check and your heartworm
Right.
testing at the appropriate time before you're starting up treatment. And so it does require trying to coordinate all of those various factors. And sometimes people are compliant and that works great. And I understand, and we have that conversation if people understand the risks. But a lot of times we do want year-round coverage, like you mentioned, for all those various reasons, from unpredictable mosquito presence to GI worm coverage. That's a huge one in those off months, so on and so to setting good habits. That's a really important point. So
Yeah. So if they
And then with
haven't, like, let's
cats,
say we have. Oh, go ahead. Do you want to go
sorry. I was
first?
just
You can
gonna
go
say,
first.
cats are tougher. So cats, yes, it is
very important. Yeah.
100% the standard of care that it's published lots of different places that cats should be on heartworm prevention. Now, for the reasons that cats get heartworms at a lower frequency than dogs do, and many cats are indoors and less exposed, I will say that it is not necessarily start part of my standard spiel to
Hmm.
recommend heartworm prevention to every cat. I'm going to admit it and say it's
No, you're not alone. I feel
probably,
like it's just not what we focus. Yeah, you're
like
not alone.
long
I know.
term, we probably will start doing that more. Maybe it'll take longer in Colorado for that to happen because heartworms are less frequent there in the dog populations, and so by definition, in the cat populations, even less.
Sure.
But I'm going to admit that my own cats are not on heartworm prevention right now. I do recommend it for every outdoor cat. What about you,
Yeah.
Lindsay?
Same thing. I feel like I could definitely be better about it. I feel as though It's definitely not as even just I know that you shouldn't rely on the advertisements, but it just the fact that clients aren't really that aware of it either. It's not something that's being pushed with them with, things they're watching on TV or things they're seeing on their computer if they're looking at their ads, right? So
Mhm.
it just is not like feline heartworm disease and it isn't as well known or as important in some ways as some of the dog heartworm stuff. So I think because of that, I don't push it as often. Same, is it you the same, Justin? Would you say?
Yeah, well, here in Colorado, we have a low enough prevalence of heartworm disease. And then, as you mentioned, cats are imperfect hosts and are rarely become infected. That, I've pulled, we do it every, few years, just kind of pull the team, since we're a team of 6 general practitioners here. And, what is everybody doing? Have you changed how you
Right.
approach this? It is not a standard of care for us to have our cats on heartworm prevention, certainly on indoor. Now, our outdoor cats, a lot of times we do, and we'll try and use one of those maybe 6-way combo products.
Right.
For clients listening out there, Revolution Plus is like a good example of one for cats that covers not all, but a lot of your external parasites as well as heartworm. And so that's a good product to be on. Now, outdoor cats are always interesting because some are coming and going, and others are, barn cats are largely outdoor and they're not even coming home that often. And so not all clients are compliant on that, but I always have the discussion if you have an outdoor cat, like, hey, this is one of the lower risks. Some of these other parasites are greater risk, but let's talk about all of them in combination. So.
And I think one of the reasons why we push prevention so hard is that one, it's one of these diseases that once we have a dog that is heartworm positive, it's not like, oh, okay, that's fine. Here's your course of antibiotic, you're done, type of thing. And you kind of wash your hands and you're clean of it. Once you have a positive patient, it really, you start going down this rabbit hole of, okay, there's a lot we need to worry about now. We need to
Mhm.
figure out exactly where your dog is as far as the burden of how many worms are present, how significant is this heartworm disease in this particular dog, and then the treatment options. There's a lot of treatment options that are out there, and they can be expensive or they can be painful or they
Mhm.
can be really long. And so there's some treatment options that aren't necessarily as simple and easy as a lot of clients would think they would be.
Mhm. Mhm.
um, I think that, I know we were talking even before the show, sort of offline, and, talking about the various options that have been offered before in the past. And, the standard and what's still on the Heartworm Society's website is, to do a 3 injection protocol for a lot of your dog, for a lot of the canine patients that are positive. And that entails, months of treatment with a variety of different medications, steroids, antibiotics, injections in the hospital that are uncomfortable, and it can be quite costly.
Mhm.
I don't know. Do you know, Krista, like offhand, probably it would be for a typical dog, like a 2 to 3 thousand, maybe dollar, maybe even more
Yeah, I
treatment.
mean, the injections are several $100s a piece, and it depends on the size of the dog, of course. A little dog is less than a big dog. I don't know. That's probably similar for you guys out there in Colorado, right?
Very similar. I commonly will quote people just a broad range of $2,000 to $3,000 for the life of treatment. And as you were just alluding to, it's a complicated and it's typically a long course of treatment. On average, 9 to 12 months and it's a two-pronged approach where you're treating both the larvae, the babies that are in the bloodstream, as well as the adult worm burden. And that's where we're using those injections. And yes, we typically follow the American Heartworm Society's guidelines of doing through all 3 injections as opposed to historically 2, which is a little more cost effective, but it's only shown to be effective at eliminating about 90% of worms as opposed to 98% of worms if you treat with all 3. And so it also varies based on the severity of disease and the worm burden, as you alluded to. The Heartworm Society breaks out the stages of disease as being kind of mild, moderate, and severe, and what those parameters are. And the cost comes with trying to evaluate how severe the disease is and is one treatment effective, because in not all cases 3 treatments are effective. Sometimes 4 months later they're still positive and we need to go back and treat them again, and so that can effectively double the cost of care. So yeah, it's one of these where the old adage, an ounce of prevention is worth a pound of cure,
Yes.
is
Yes.
very, very true, both from a cost standpoint, that's huge, but more importantly from a health standpoint for your pet.
Yeah.
Yeah,
And
so I mean, the day they get diagnosed positive, from that point forward, you're talking about an absolute minimum like treatment plan of 4 months. And then,
Sure.
you know, longer perhaps depending upon if they come back still positive later. And that's regardless of which treatment, there is an alternate treatment that's being
Sure.
started to be used, and that's still a lengthy period of time. So day 1, the first thing is evaluating how severe this is. And like Justin was saying, you have to know how advanced this disease is to know how concerned to be, how aggressive to be in terms of the treatment and
Hmm.
hospitalization and everything, what other meds you might need to do. So, that day you might have x-rays done, you might have x-rays and blood work done. Sometimes these dogs specifically are severe enough that they need to have an echocardiogram to look and see
Hmm.
how many worms there might be. There's a very severe syndrome that is called caval syndrome, where the worms have worked their way all the way into the vena cava and are actually blocking up these vessels to the point that animals are basically in failure. Their heart is
Right.
failing.
Hmm.
So those animals may need to have the worms manually like picked out, which is
Yeah.
not what I'm gonna do.
Yeah.
I
Yeah.
you
mean,
know.
some of the images of really severely impacted animals, it's quite impressive. I mean, some vet hospitals will have little models of a heart and like the worms like spewing out of, their main vessels. So,
We used
I
to
mean,
have
Hmm.
it's
that. Where did
not
those
it's
go?
yeah, they're huge. And so that's the other thing. I mean, treatment sometimes can be dangerous because you're essentially killing these parasites, killing these worms that are living inside vessels, and you can get these worms to die off and go and clog different areas and cause basically emboli in the animal's body. So it's
Hmm.
treatment is also not completely benign. It can be dangerous in and of itself.
Yeah, it's a really important point. And so the risk of treatment is real as well, because we do see, a number of patients will experience some complications, the majority of them minor, but they can be major, like you said. But obviously the alternative to treatment is not treating them, and this is considered a fatal disease in a number of cases. A lot of animals that go untreated will progress to the point where it will cause failure, and by either backing up the heart, as you alluded to, or something similar. So yeah, definitely one of those where that's why when you talk to your veterinarian, they're going to really emphasize the importance of heartworm prevention, because it's so beneficial at preventing all these things.
Yeah.
So
And as a veterinarian, we get no kickbacks from any of the heartworm prevention people. So I feel like a lot of times they think that we're getting something extra, like an extra,
Like my pet
car or
doesn't need
something.
this, and yeah, yeah.
We get nothing. We
Um,
get nothing.
yeah, yeah.
and then cats are a little bit of a different story with regard to treatment. So cats are small, right? And they're smaller than the ideal host dog would be, like a wolf size or a coyote size dog. So cats will often, because they can to some extent fight off these things, they end up with only a few worms, right? A low worm burden. But this worm is 14 inches long, which is, I think, the length of my cat, right? So, those, it's actually too risky to treat them with the standard treatments that we use in dogs, because if you do, you could be blocking up major blood vessels or actually embolizing an entire portion of the lungs. You could really kill them with that.
Yeah.
Hmm.
So a lot of the time the cats are basically maintained on steroids or, other medications to really just keep them stable enough until that worm slowly dies on its own. And that's
Hmm.
that's not great either, right? Those animals are coughing and they're often sick, and that can kill them, but treating them with um the actual melarsamine, the standard treatment, is just too dangerous.
Yeah.
Hmm.
Probably the only
How?
positive thing about heartworm is that it's not transmitted to people. So we don't have to worry about getting sick if we have a pet with heartworm disease. So
Hmm. How frequently, Krista, do you guys see cats that are positive, or in your career, even have you guys seen cats that are
It's
positive?
always the question. Do I know of any positives? No, I don't. I
Okay.
haven't personally had any that I've definitively diagnosed as
Hmm.
positive.
Hmm.
But they do tell us that like some of these asthma coughing cats, like I'm very frequently doing heartworm testing on those guys just to make sure that I'm not missing
Sure.
something like that. So um I don't know, Lindsay, have you seen a heartworm
I
positive
have
cat
also
yourself?
not ever personally diagnosed a heartworm positive cat.
Hmm. Yeah.
But they're
Um,
also harder to diagnose, so
it's true.
there very well may be ones that I have just simply missed, right?
Yep.
And we've treated
Sure.
them because they're asthma with steroids and.
Yeah.
Didn't
Sure.
really know.
Yeah, and I similarly have never diagnosed one myself. When I was in vet school, had one that we were treating, a cat that was positive and trying to deal with the secondary complications therein. And then just polling my colleagues here in Colorado, of the six of us, two have experienced a positive case at one in one in their career.
Yep.
Um, and so, yeah, it is not a common disease to see, but to your point, it's also probably underdiagnosed because of the
Right.
facts that we don't see it. It's a vague presentation. It's difficult to test for, even if they're positive and you're suspicious for it. A lot of times they'll repeatedly be tested on various methods of trying to test them. So it's a tricky disease when
Mhm.
cats do have heartworm.
Now, Justin, what if you had a client that had, really wanted to rescue a dog and they knew that the dog was going to be heartworm positive? Would
Yeah.
you advise against that? How would you sort of guide your client?
Yeah. So, admittedly, I don't usually get many clients that come to me and say I'm thinking about adopting a dog. But I wouldn't, if I had a friend or somebody were to reach out in that
Yep.
instance, I would advise somebody that they're this is not something that should necessarily be a deterrent, so long as you understand the implications, the cost. You just do your homework and gather as much information, and I'm obviously would be there to help provide that, but certainly it starts with working with the rescue group to find out how much information has already been gathered, how much after the adoption will we then be providing, and what stage are they at, because some rescues, there's some really excellent rescue organizations here in Colorado that will actually perform treatment and appropriate
Yep.
American Heartworm Society recommended methodologies to treat dogs that are positive. And then other instances, not to say the rescue group is any less excellent, but
Right.
sometimes they'll adopt them out positive and then advise, hey, here's the ramifications, and work with your local veterinarian. And sometimes there's, financial incentives to help aid with the cost of care and stuff. But I think really, finding out the severity of the disease is important, so people know, is there a risk of lifelong complications, secondary complications, or what is the risk of treatment? That's really important, because it's super hard, as I'm sure you guys know. If
Yeah.
you adopt a pet, the risks are there with treatment, and maybe something goes poorly. Gosh, that can be devastating when you have a new animal you've fallen in love with. But no, I don't want that to ever be a deterrent, unless you feel like it's maybe too much for you.
Yep.
Certainly there's a lot of pet owners out there that could tackle that potential challenge. So I don't know if you guys recommend similar or different, but
Yeah, I don't deter people necessarily from adopting a known heartworm positive. I mean, the reality is that we see so many dogs coming from locations that are hugely heartworm areas like Tennessee,
Mhm.
the Carolinas. And so it honestly, it's a risk for any dog that is coming from those areas, and they're gonna test them at their rescue. But many times, we know that there's a lag between when the animal is exposed to heartworms and the test becoming positive, which is 7 months or more. So, these dogs could be shipping up here and they think that they're negative, and then
Mhm.
Right.
we test them. That was one of my cases this year. They tested them at their annual visit and it came up positive. Well, it didn't get its heartworms actually around here. It had them and just hadn't tested positive yet,
Sure.
because you have to have adult worms for them to be, they can be early in the infection. So it's kind of always a risk, y- for any dog. But I mean, the biggest thing I think is the rest requirements, right? Like, yes, there's the cost of treatment, but then now they have this new dog that they have to basically keep completely rested during the course of treatment as well. And that is because you don't want to get the blood pumping too fast to push these worms forcefully out. I describe it to my clients as like when you're drinking bubble tea. Have you guys ever had bubble
Oh,
tea?
No,
Now,
no.
maybe
no.
I shouldn't describe it that way because nobody's ever had bubble tea, but like you're sucking something through a straw, right? And you get a bubble and you have to suck harder, right? To get it, and then it blows into your mouth. And
Oh
boom,
my God. That's
right?
hysterical.
So the same thing happens with the worms. If you're like, you're trying to clear something out of a straw and you would just have to blow harder and then it just
Yeah.
expels out. And that we don't want during their treatment. And so that's a big thing for a
Mhm.
lot of new owners, that they just got this new dog they're trying to associate with, but now they can't bring it to all the fun things. They can't
Mhm.
necessarily
Right.
do obedience training. They can't take it on big long hikes and walks. They have to wait.
Yeah, yeah, and that's probably one of the most common factors that I'll talk to folks about, other than all the health ramifications, the cost ramifications.
Cost.
It's really, you're bringing a new pet in your home, and they probably need to be sedentary for some period of time just due to that risk of exercise induced complications. Yeah, and a lot of people are willing to take on that challenge and stuff, which is wonderful. And that's been my experience over the years, that so many people are actually willing to take on a heartworm positive dog, and they should, because they're oftentimes wonderful pets. So yeah.
I have had one client that adopted a dog from, one of the southern locations, came up and they didn't know it was heartworm positive.
Mhm.
The group just didn't test them. And so those owners were just, initially devastated, but then,
Sure.
they had already, like you said, fallen in love with this dog. And this dog is now like a year plus, had been adopted,
Mhm.
treated, did great. And the people couldn't be happier. So it definitely can end well. But yeah, just knowing what you're getting into, I think, is huge.
Yeah. Oh, something that you mentioned though, Krista, which is really important, is that lag time from when the rescue group
Yeah.
has tested them and they're reported as negative. A lot more and more and more rescue groups, certainly in our area, are providing heartworm testing, other disease testing, fecal testing, et cetera. And even if they're negative, a lot of times your veterinarian is going to recommend additional testing. Sometimes when they're first meeting them, sometimes 6 to 7 months later, just to help ensure that they're negative. And it's really important because there can be that lag time between when they first tested. They may have worms, test negative, and they may develop into mature worms and
Right.
test positive
And you
later.
want to know as soon as possible, right? You don't want to
Absolutely.
Yeah.
be letting the longer, this is a game with time a little bit. The
Mhm.
longer those worms sit there, the more damage they can cause. So
Mhm.
if you can catch
Mhm.
them early and get them, treated right away, great. But you can't test them too early isn't necessarily going to help you, because you could just have this false sense of security that
Right.
Sure.
it's negative and when it's really not. So, I mean, heartworm testing, these are really common questions that we get. Why am I testing every single year?
Mhm.
I do the heartworm prevention every single month,
Right.
which is great. And your dog is and cat, if you treat them with preventatives, are really way less likely to get heartworms with that. But we still do test annually. So I don't
Mhm.
know. Do you guys want to explain to all of your viewers why?
Well, we do often at Bulger, at least, we'll, and this is again in Massachusetts, we do a 40X, like sort of a combination test. So test
Mhm.
not only for heartworm, but other like common tick-borne diseases too in the area. And so I feel like it's a great test to do annually for a few different reasons. One, are the owners really being good about the heartworm medication? Sometimes they think they're being really compliant, but they probably have missed a few months here or there, or they haven't been as precise as they thought. And so making sure that we really aren't getting a positive dog early on in the course of the disease. So if they missed 3 months and the dog was exposed, catching that now as opposed to when the dog is clinical is going to be a huge difference. And the fact that we can get information on the tick exposure, I think, is awesome because we follow up different protocols with those things as well. So, I really do try to push annual testing for that particular reason. And speaking about preventatives, there was actually an interesting case that was posted on our Facebook page, not our Facebook page, just a veterinary Facebook page about the heartworm preventions and especially like the chewable forms, making sure your pet really is chewing it to get that full medication. Because often, if you give them those big chew tabs and they inhale it and eat the whole thing, it's not necessarily absorbed really well. And in some rare cases, can actually cause like a GI obstruction, which is what happened in this particular case. It actually got
Hmm.
stuck. The huge heartworm chewy chunk got stuck in the intestines of this dog. So, again, making sure the dogs are really chewing the heartworm prevention, they're getting that medication, they're getting it on a monthly basis, and I like knowing about the tick exposure too as well.
Mhm.
What
Mhm.
about you, Justin?
And I think another point, all the points you just mentioned are important. But then I think another one is that no medication, even if you're giving it every 30
Yeah,
days year round, is 100% efficacious. There's a few issues that we have. One is, I don't have the studies at my fingertips, but it's over 95.5% effective, most all your heartworm preventatives, but it's not 100%. So there are
right.
some cases where it's not going to be effective. And what are some of those reasons? It could be um, anthelmintic or parasite resistance. That's the term for parasite resistance. And so, are the worms starting to develop resistance to a specific type of medication? Over time, that is going to be a sad reality that can happen. And so unless you test for it, you'll have that false sense of security that they're going to be protected when they may not for whatever reason. And there's a host of other factors, but that's kind of an important one I wanted to emphasize.
That's a good
But
point.
yeah, and we do the same where we really want people to test annually for a number of those reasons: the lag, the incomplete coverage, where it's very close to perfect, but it's not perfect. So,
Yeah.
and to your point, if a dog isn't chewing it and they only get a partial dose because they inhaled that, you think that they're protected and they're actually not, even though they ingested it. So,
Well, one of my clients found like 8 months worth of heartworm pills
oh
behind her
no,
couch.
oh
Oh
Like the
no.
my.
dog's stuck 'em back there.
Smart
You know,
dog.
one thing to address too, and we would be remiss if we didn't mention it a little bit, is this whole there's other proposed treatment options besides the standard melarsoline, right? And they're not on the American Heartworm Society's plans at this moment. But so you'll see things like slow kill, and I say that in air quotes, out there. So slow kill as a term is a little bit dated at this point. There's a lot of different I guess things that theoretically would fall under that. Slow
Mhm,
kill is definitely not the recommended treatment option, and that is when you just put a dog on heartworm prevention and you just
Right.
cross your fingers and hope that eventually those worms will die. And in theory, many of them will die, but not 100%, and it takes a long time, hence slow kill. So we don't recommend that. Even some rescues will recommend it, and it's just not the standard of care. It also induces some of that resistance, like Justin was talking about.
mhm,
So, but then there is one intermediate option, which is really starting to be scientifically backed, and that is using a particular product, moxidectin, which is available in one of the topicals. I don't know if it's in multiple ones, but that's Advantage Multi, which actually has been studied and is starting to be supported by a lot of cardiologists and respiratory specialists, but it's not yet on the American Heartworm Society
Right.
um, recommended protocols. So
mhm,
it's something to discuss. It isn't slow kill. It's not the same thing, and it does kill those heartworms in a similar time frame to the standard melarsoline. But again, it's sort of an up and coming treatment that may become standard of care moving forward, but it sort of isn't right at the moment.
mhm,
Yeah.
mhm. And what Chris is alluding to for the listeners out there is that, I mentioned that there's kind of a two-pronged approach to treating a positive case, one being treating the larva, the babies, and one being treating the adults. And so that quote unquote slow kill method is using a medication that's only intended to prevent the larvae, and it doesn't theoretically treat the adult worms. And so, I anecdotally, I'll tell you, I've had cases that have been adopted out of rescues and been treated for 1, 2 years. They've been positive with heartworm disease, and they've been treated with just a monthly heartworm preventative, not moxidectin, which is Advantage Multi, and still 2 years later, they're
Right.
testing positive for heartworm disease. And so, yeah, that is one where I've seen a reasonable number of cases spread out over the years that have come in that are quote unquote on that method. And they were released from the rescue. Client was given limited information, but essentially told, hey, we're treating this and it should be just fine. And they're still positive. And so there's a lot more work that needs to be done around educating those clients and treating those patients appropriately with treatments like melarsoline, or if there's other limitations, sometimes moxidectin, the Advantage Multi approach, is at least an intermediate solution with not as much information behind it, but it has been proven effective in some cases. So,
Yeah.
Lauren and Rachel, do you have any other questions that you needed us to address? Or are we good?
We have nothing else. Rachel just recently went through this, so we've been talking in
Yeah.
the background, kind of going
wow.
back and forth like, yep, yep.
Yeah.
Yep.
Yeah.
Yeah, it was
Um,
just like you said, it was a Southern rescue. Got her, she's like 10 months old. Her heartworm test had been negative, but then, at her annual next summer, she came back heartworm
Yeah.
positive.
How is your dog doing following treatment, and where are you? I guess where are you at in that protocol, Rachel?
We are kind of in between. So we have to wait, I think, what is it, 6 months after the last treatment, after the last
Mhm.
injection to do the final heartworm test. So that will be in June. So we're kind of at the end,
Close.
assuming that she'll be negative. Yeah.
Great. And how is your kiddo doing?
She's doing good. It was a tough one. She's a high energy dog. She's
Oh.
mostly like border collie and Australian shepherd. So it was really, really tough for those
Yeah.
months that we had to keep her, super restricted. But she's doing great. Otherwise, she had like a pretty much asymptomatic case. So she was never coughing. She never had any lethargy or anything. We didn't even know. So yeah, she was kind of great all the way through. We got lucky.
That's really good. That's really good to hear.
A good story.
Yeah.
All right. Well, I guess we'll wrap it up then. Thank you to our sponsor, Ethos Veterinary Health. Don't forget to rate, review, and subscribe to us on your favorite podcast platform. We do have a video version available on YouTube, which is under Ethos Veterinary Health.
Yes, and we want to thank Justin very much for coming today. This was awesome. You can find his hospital, Wheat Ridge Animal Hospital, on Facebook as Wheat Ridge Animal Hospital and on Instagram at Ethos Vet Health. So we appreciate you coming out. It was super cool talking to somebody out in Colorado, not California. Maybe Krista and I think we need to make a trip out there to really, appreciate the region. So I think podcast should send us out there next time.
I like it.
We'll see.
I like it. We'll be happy to
We'll
host you
see,
if you
she
ever make
says.
that work. So, no, I appreciate the opportunity to come on. This has been a super fun experience. It's really nice to talk to other like-minded, similar practitioners just in different regions and hear what the differences are and what you folks are doing that may be similar or different out here. It sounds like we're all of the nearly identical mindset in terms of how we approach this disease, just some regional differences to what we're seeing. So. Thanks so much for having me. Really appreciate it.
Thanks.
All right, we'll see you guys next time.
Bye.